Welcome to our next video in the series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. We are now into week 18 of Maddie's post-op recovery from her ACL surgery. We're working on strengthening her sprinting technique, sport-specific skills, developing her overall fitness base, as well as working on the field work and the playing surface as was detailed last week. She's jogging and running to develop her cardio base, stretching and strengthening at the gym, doing some strength and functional activities in the clinic, and doing her field work. Now during this week she was going on one of her conditioning runs, and she was about 5 to 10 minutes into the run when she suddenly noted a sharp pain in the posterior part of her left knee. She rated it 6 out of 10. She stopped running, actually called her mom to come pick her up and bring her home, iced for pain and swelling. They called me that evening. I saw her in the clinic. She had full motion, moderate generalized swelling in her knee, negative Lockman's and anterior drawer, but she had medial joint line and posterior medial joint line tenderness. You can sort of see in the picture here there's some generalized swelling. Based on these findings, the differential diagnosis could be that we broke some adhesions, pinched an internal structure like the posterior horn of the meniscus, had some posterior lateral corner instability, or developed a meniscus tear, or the repair failed. Based on the mechanism or lack of mechanism in the findings, the meniscus tear or repair failure are the most likely scenarios. So I spoke with Dr. Schwartzberg, who ordered an MRI. The results of these came back that there was a complex tear of the medial meniscus. The lateral meniscus was intact and the ACL was intact. So after some discussion, it was decided that we discontinue therapy at this time. She'd have an arthroscopic debridement done in the next couple weeks, and then we'd reassess her and resume therapy at that time.